No, you can start from where you were. Sorry about that.
All right.
All
All
right.
right. So,
You may have to share your screen again. Sorry about that, doctor.
no worries, no worries. So again, my name is Dr. Tahmasian. I'm one of the sports medicine physicians at Seaview Orthopaedics. Thank you for inviting me. Always happy to share my knowledge and educate anyone as best as I can. So today I'm just going to talk about concussion management and young adults, be it teenagers, college students, middle schoolers. I mean, this talk really applies to anyone at any age, really. As far as disclosures, I don't.
Dr. Tahmasian, if you can just reshare the screen. I think the screen went off, so people can't see it.
Oh,
sorry about that.
No worries. Share screen. Sure.
Yep, there we go. Yep, we're good now.
Okay. So I don't have any disclosures. This is just an overview of the talk that I'm gonna talk about. So first, we're gonna touch base on what is a concussion, why and what happens. We'll briefly touch on the symptoms, what can we do, what are our options as treatments, and what do we do, how do we decide, and how do we get our athletes back to playing. So as far as concussion, concussion is also called in medical terms. Sometimes you can see it in your, physician visit notes as traumatic brain injury. They go hand in hand. It's basically a concussion happens when there's a trauma to the head, whether it be due to contact, where someone gets hit into the head or lands on their head, but it can also be to forces that translate from anywhere in the body, and those forces affect the brain. And this can be, either a football player or a basketball player falling down, hitting their head, or someone, say, in a car accident, has a whiplash and the forces translate to their head and they start having concussive symptoms. Now, typically concussions are, happened very rapidly, and they are self-limited, meaning they're short-lived impairments that affect the brain. And the signs and symptoms are largely because they end up having some sort of functional impairments in the body, whether it be structural or psychological. Abnormalities are usually not seen on any sort of standard imaging. So just because someone has a concussion or someone has a concussion doesn't mean if we get any sort of imaging, it's going to prove to us whether or not they have concussion. It's more of a clinical judgment, and signs and symptoms we see and patients report to us that we are that we get to arrive at a diagnosis of concussion. It is highest among boys playing college sports, be it rugby, American football, ice hockey, and lacrosse, and among girls, those who participate in soccer, lacrosse, and field hockey, those guys are at highest risk. Now, on the flip side, when you look at the adults, motor vehicle accidents and falls are among the highest reasons for concussions, and usually for older adults, falls are the main issue. Other reasons could be some sort of work-related injury, some sort of recreational accident, or even assaults, people being in fights. So why does this happen? Why do we get concussion? Basically, concussion is a insult to the brain, where it causes stress and energy imbalance, and your brain doesn't know what to do with it. Now we need to make sure these patients are not experiencing these symptoms either by drug use or medication use or other types of injuries. Hence, our clinical judgment and exam is necessary to really go through with the patient, have a one-on-one discussion of what's going on so they can explain it to us, and together we can come up with a diagnosis. Now, years ago, we used to grade concussions, grade 1, 2, 3, but we really don't use that any longer, and we've just stuck to saying, okay, you either have a concussion or you don't. There's no severity. Now, if you do end up losing consciousness because of a head injury, that doesn't increase our severity scores. We just either call it concussion with loss of consciousness or without. As far as symptoms, these can be very, very variable among one person to another. Even say if you have one patient and they experience concussion and they've been diagnosed, it doesn't mean that the first time that they ended up having a concussion, the second time around, God forbid it happens, they're going to have the same exact symptoms. And that is completely untrue. And every single concussion is different. And even when it comes to treatment, we treat the individual, not the diagnosis, because what the patient feels and what symptoms they tell us and what we see in the exam is going to dictate what we're going to focus on as far as treatment. As far as some of the physical symptoms, they can have headaches, nausea, dizziness, sensitivity to light. And those can, at least headache and nausea, we can treat them with medication. And when it comes to some sort of dizziness or balance, then that's when we start looking into therapy. A person can end up having mental symptoms, and a concussion can actually exacerbate feelings and symptoms that were there before and just multiply it by 10 or 100. So if someone ended up, that day or throughout the last couple of weeks, or has an undiagnosed, very mild depression, when concussion happens, those symptoms tend to increase and become 10 times higher. Sleep disturbances, I see this all the time in any age. And it's one thing that we spend time and time again, not only with people who are concussed, but also the general population, and usually coaching and talking about proper sleep techniques is the way to go. And from the emotional standpoint, a person who ends up having concussion, they might end up being extremely irritable, or for very subtle, small things, they can get extremely upset or anger to the point that it just, say a pen drops and they can just get very, very extremely angry. So everything just gets exacerbated. Now, most of these studies and clinical findings on concussions in children have been focused on kids 12 and or older. There are studies that have performed in children ages 5 to 11, and they end up having similar types of symptoms and signs, and frequency of the as well as frequency of clinical features. Among children 4 years old and younger, the diagnosis of concussion becomes very challenging because, as you can imagine, they can't really communicate very well and articulate what they're feeling. So that's when we start relying on a parent or a caregiver. Now, that doesn't mean, say, a middle schooler or a high schooler comes into the office, I'm just not going to listen to the parent. That is completely untrue. In fact, I have seen kids come into the clinic room and they're unable to communicate with me, and that's where I need a parent, a guardian, someone who knows the patient that I'm seeing to give me some sort of report of what's going on. So say, you have your kid or something, God forbid, happens during a game or during practice. What do we do? So the number one thing, and this is the most important thing when it comes to concussion, if there's any sort of head injury, the first thing to do is prevention. And prevention is very, very key for these kids, because they may, you can have a kid ends up clutching their head and comes to the sideline or comes out of the practice and they're all foggy and dazed. And, as a teenager, the only thing that they care about is going back to the field and continuing to play. The bad thing about that is that if they continually get hit while they have symptoms, this is going to possibly put them at risk for more injury. So whenever you see that, especially if there's somewhat of a high impact, then the suggestion is to take them out of the game, even 5, 10, 15 minutes, to make sure they're okay, for us to safely put them back into the game. Hence, you see athletic trainers or even physicians on the sideline trying to take out the kids and even removing their helmet and taking their helmets away in order for them not to be able to come in. Sorry, just a second. Submit all. All right. Sorry, I just had to invite more people. I guess I'm the gateway for people. No, no problem. So I talked about prevention being key to remove these kids, removing them from any sort of physical activity and any activity that increases risk of fall. That's why when an athletic trainer sees the kid and evaluates them and they end up suspecting concussion, they are not allowed to return to any sort of physical activity, because the fear is putting them at risk for more injury, and then we just end up end up being behind the ball, and we want to prevent that. Now, once the patient is out of the game, what do we do? The next 24 to 48 hours, I'm somewhat lenient on it. I say let the kid have rest, whether it be physical, mental. Don't stimulate them too much. But at the same time, I see caregivers taking the kid putting them in the dark room and isolating them. And what that does is completely socially isolate them, and we take further steps back instead of taking steps forward. So what I say is relative physical rest and relative mental rest. Now, what does that mean? It means that, for the 24 to 48 hours, keep things at a calm level. After that, then you can start introducing different types of activities. And when I say that, I mean very, very gradual increase. Maybe it's, taking out the trash or going for a walk around the block, reading a book. If they can't read a book, then stop, do something else that they enjoy. Bring out card games, board games, play. If that bothers them, take it away, have them rest. And make sure that, if someone is suspected of a concussion, to seek help and see a trained professional to be able to guide you through the challenges that a concussion ends up presenting to patients. Oh, it's not going. Now, say your kid ends up getting pulled out of the game, and you go home, or even on the field or at school. What would be the signs for you to end up sending your kid to the emergency room? So some of the red flags that we use as providers, medical providers, is if a kid ends up vomiting multiple times, if they suddenly lose consciousness, end up having seizures, or they're complaining of neck pain, or all of a sudden they're seeing blurry and double vision. Those are some of the red flags that would indicate to us, okay, this is not something to take care of at home or at the sideline, and we're better off sending them to an emergency room for a more thorough evaluation right away. Or say a kid starts deteriorating or says, oh, this is the worst headache of my life, or they have a headache and it's just continuously getting worse. Those are your warning signs to take the kid to the emergency room. Now, these are not the only ones. These are just some of them. Hence, having your athletic trainer on the sideline to help and evaluate the kid is extremely important. Now, a question that I get a lot is, are there any tests? How do you know my kid has a concussion? Because my kid got hit in the head, and there must be something wrong. Unfortunately, there's, we do not have any sort of imaging modalities to determine if an athlete or a regular person, for that matter, has a concussion or not. There are no structural damages or changes when a concussion happens. Can it happen? Yes, but those are usually in more severe cases. Hence, we give the red flag warnings for you to take them to the ER. On the other side, we get asked a lot about blood tests. There's no study that has provided us to say if a child or a person has a concussion or not through a blood test. Whereas, and I said before, our clinical exam or discussion with the parent, caregiver, the patient themselves, along with a computerized test, allows us and gives us tools to put everything together, and based on experience and clinical judgment, come up with the proper diagnoses. And you can see, I'm sure many of the parents are familiar with impact testing, we usually end up having kids in sports and in athletics do a baseline impact test preseason. And this is usually done yearly. And in some colleges, they end up doing it every other year. It just depends on their policies. That way, we have a test score to compare to for us to determine whether or not concussion, if we need to determine by a test if the concussion is resolving or where we are, what sort of treatment plan should we have or add to improve patients' outcome and prognosis and treatment plan. Now, as far as treatment, it varies from person to person. And as I said, even a person having 2 different concussions at separate times, we might end up having different sort of treatment plans. That's why seeing a specialist will, especially in prolonged cases, is going to help you determine what sort of path to take. Now, there are general treatment plans that we give all of our patients, and that is, if you're reading, get some easy material to read. If you have light sensitivity, it's good to wear sunglasses to just block the light. Some patients end up asking me about blue screen. There's not really good evidence about it, but I say to people, if it helps you, use it. Or even those blue screen sunglasses. If it's way too noisy and noise is bothering you, a simple thing to do is use earplugs. If that's not helping you, remove yourself from the situation, get into a quiet environment for everything to settle down. And if this is a recurring time, maybe it's not the right time for you to do those types of activities. Or if you're someone who, if you have a kid or someone who likes to go for walks, and you say you like to walk 3 months. Well, you're not going to go from 0 to hero all of a sudden. So I say, take walk around the block 1 time. If you're doing well, don't push yourself. The next day, go around 2 blocks and increase it gradually. And if you, say 5 days later, you ended up going for a 10 block walk, and at 10 blocks, you start having headaches, that's a sign for you to, hey, this is too much for me. Maybe I should step back a little bit and then try it again at a later time. Now, sleep is extremely important. Now, the first 24 to 48 hours, I give them leeway. If you want to take naps, you want to rest, you're crummy, go for it. But after 48 hours, a good night of sleep is key. So I usually tell patients after 48 hours, try not to take a nap during the day. Keep busy. If you need to take frequent breaks, go ahead and take them and save that good prolonged sleep for the night, because that's going to help you recover faster. I do get asked about medications, and unfortunately, there's no medications that have been proved to help sleep hygiene, especially when it comes to concussion, and there's no medication that has been proved to speed recovery, nor are there any supplements. Now, when we go through treating concussion, it's very, very normal for the symptoms to get worse one day, get better, get worse, get better. And the overall trend that we're looking at when we look at these concussions and we're tracking your symptom scores, is that we overall see a downtrending score. Whether one day it was super high, the other day super low, especially when it comes to kids, they end up having tests, they end up, being on their phone too much for one day, or they're chatting on their WhatsApp or Instagram a bit too much, and the next day they're going to end up feeling crummy. So those are things that we have to take into account. Now, I mentioned iPhones, tablets, iDevices, anything. Those are very, very counterproductive when it comes to concussions. There's been actually studies where people who have had no access to these iDevices and screens, they've ended up recovering 5 days earlier. The main problem with these screens is especially these fast-moving videos. So TikTok, Instagram, these YouTube short videos where they end up having very fast-paced short videos that go on and on and on. Or if I see a kid on their Instagram and they're just scrolling, when you have a concussion, since there's an energy imbalance in your brain, and I want to say there's communication errors, but that's just taking it a bit too far. They end up worsening their symptoms because they can have some sort of dysfunction in their ears, in their eye, and there's not good communication. So they end up worsening the symptoms and not letting the brain rest. So my general advice is just keep the phone away. You're going to do better in the long run when it comes to recovery. You recovered, you can go back to your normal daily activity. Now, the problem becomes, kids end up texting each other or wanting to FaceTime each other. So my solution is that instead of taking the phone away and limiting their social activity, which is counterproductive, I say let them FaceTime, but instead of looking at the phone, put the phone somewhere else, put it on the table, don't look at it, and use it as a speakerphone. If you want to watch Netflix, don't watch it on your phone or tablet. No screen that is going to end up moving. Watch it on a TV with less brightness, with family, but don't push yourself too much, because if you look at the screen too much, then you're not really helping yourself as far as concussion goes. Now, the treatment becomes a little bit complicated in patients who have multiple symptoms. That's why we end up using either physical therapy to do some sort of ocular rehab or vestibular rehab, ocular being eyes, vestibular being your balance system and your inner ear balance. We might even send a kid to an optometrist because, say, they're not their eyes, they need sunglasses. I've even had a patient, I saw a patient last week, they needed bifocals. The solution they came up with for themselves was to wear their contact in one eye, not on the other. And that ended up worsening their symptoms, but that's what they thought was good for them and what worked for them in the past. But the issue is with concussion, it's not the same. That's why going and seeing an eye doctor at times is helpful for us. Other things that we have in our pocket is neurology, neuropsychiatry, and even psychologists and psychiatrists, because sometimes with concussion, if someone has an underlying undiagnosed anxiety, depression, it can exacerbate those and they can come forward. It doesn't mean that you're going to have a diagnosis of depression or anxiety, labeled to yourself, but it means that, hey, I'm concussed, I need help, there's a specialist that can help me, why not go and see them? So I talked a lot about treatment. How do I decide, or how do we as a team decide when is it safe for us to go back to play? So the requirements are that they have to be symptom-free, at least for 24 hours. And with the help of athletic trainers, we put them through paces, usually a 5 to 6 day, what we call return to play protocol. And basically what we do is that we gradually increase their exercise activity, and the goal is to increase their heart rate little by little and to monitor their symptoms. And if they end up having symptoms, that's a step back, and we have to address that and go back to, not necessarily go back to zero, but and start from scratch, but we need to come up with a plan to help the patient get better and hopefully get them back into to their game, to the activity that they love. Now, sometimes we may decide to retest using impact to truly see what's going on, because especially if the symptoms are really prolonged, something's not getting better, we need more answers. We just don't want to do the same thing over and over again, knowing that something's not working. So that's where follow-ups are going to be important for us to see the patients again and revise the treatment plan. Now, on to some myths and facts, things that I've heard over my training and over my practice. I've heard things like, hey, concussion, concussion happens only if the head gets hit. And I think I've proven to this point that any injury truly that ends up having transmit forces up to the head can cause a concussion. The old wives' tale of, hey, don't let them sleep, or keep them up at night, that is very, very counterproductive. In fact, sleep is one of the most important things that kids or anyone with concussion should have, on top of good nutrition, for them to be able to recover. As you can imagine, I've used the word energy imbalance multiple times, and in order for us to recover, we need nutrition to support our body, and to regain and recover, sleep on top of nutrition are both important. The other thing I've heard is, nothing makes my concussion better. I'll just get better. All I need is time. That's untrue. Yes, concussions eventually get better. Yes, most of the concussions, majority of the concussions get better on a short period of time. However, there are evidence-based treatments out there, and it varies from one person to another, for us to be able to help a patient, whether it be an athlete, an older adult, or someone who's had work-related injury or has been in a car accident. There are treatments available to get you better faster. Other things, concussion only happens if you lose consciousness. No, that's not true. You can be in a car accident and with whether seatbelt on or not, hopefully you're wearing a seatbelt, and your head whiplashes, goes back and forth. You haven't lost consciousness. You can still have a concussion, or you can have a kid hit with a basketball to the head, or I've even seen a kid get a locker. They were horsing around, and one of the kids ended up slamming the locker door onto the other kid's head, and they ended up with a concussion, but they didn't lose consciousness. The other thing I would hear is everyone has the same risk for concussions. So when you come to a visit, there are multiple questions that we end up asking. We ask about family history, we ask about learning disorders, ADHD, anxiety, depression. All of those are important risk factors for us to know to be able to guide the treatment in the right direction. Because one person from another, everyone is different, and everyone is going to need a different sort of treatment plan. Last but not least, and there's many others, is that I'm just gonna have them in a dark, quiet room because rest is all they need. And as I've said, yes, rest, especially relative rest, is key for recovery. And all of our concussions are eventually going to resolve with the right treatment plan. And with that, I'm going to just open everything for questions and conclude my presentation.
If you have questions, please feel free to unmute yourself to ask questions. You would just have to find your name and click your mic and unmute, or your chat, or go to the chat. If you don't want to be on camera, we know some people are camera shy, so please feel free to go to the chat and type out a question. While they might be typing out questions, I have some questions, considering I just had a bump to my head. Is there any like delayed possibility of concussion? Like, a concussion might not happen right away? Does it like have a certain period of time after where you could get like a delayed concussion?
No, usually concussions are pretty they happen pretty fast. If there's any symptoms, you should see it within 24, 48 hours. You wouldn't have a concussion, say you got hit in the head today, you wouldn't end up having symptoms a week or two later. There's probably something else going on.
And then if you do have a concussion, if you're an adult, like let's say, you bumped your head as an adult and you're driving, are there restrictions, like you have to be cleared to go back to driving?
Oh, absolutely. Absolutely. So, this not only applies to driving, but also anything that is going to increase the risk of falls. So say riding a motorcycle, or something as innocent as riding your bicycle. So if you end up having double vision, blurry vision, you're dizzy, you can't get your balance straight, obviously, you want to stay off of the road. And, if you come to the office, we'll probably restrict that. And, we end up modifying your activity to make sure you do things that decrease the risk overall, whether it's, whether it be driving somewhere, or say biking down the lane, or even exercising, because you can go and exercise, and I've said physical activity is good for concussion, but you don't want to push yourself or go out on a bike ride and end up falling again, which is going to just make the concussion worse. And it's going to, in case of driving, it's going to put others and yourself in danger.
Excellent, thank you. We do have a question in the chat from Donald. Can you have signs of a concussion without actually having a concussion, like after, I guess, a hit?
Not, I mean, with concussion, you usually have some sort of sign and symptom. And if you like, I guess I need some sort of clarification in the question.
If I'm dizzy after I get my head hit, let's say, is that necessarily always going to lead to it being diagnosed as a concussion? I guess if you have some of the symptoms of a concussion, but it's not, is that always necessarily a concussion?
Well, if there's been an incident and you ended up having some symptoms, yes. But if nothing has happened and all of a sudden you ended up having dizziness or weakness in the arm, those can be due to other medical reasons, which would need you to see your physician.
And then one other question was, were there any long-term ramifications for like memory if you've had a concussion? I know it's like case by case, but does it lead to, memory issues down the road?
No, all concussions eventually resolve and recover. It's the issue becomes how compliant kids end up being with the treatment plan. And teenagers being teenagers, sometimes they don't listen, and sometimes they end up lying. Sometimes they end up doing things that they shouldn't do. And even as an adult, like I do sometimes things that I'm not supposed to do, and I get worse. And I'll leave it at that.
Anybody
Just
else?
don't ask my wife what.
Listen, she'll be the first one we'll ask if you're doing something wrong. Okay.
Yeah.
Anybody else? Again, please unmute yourself if you have any questions, or feel free to type in the chat. We'll just wait another minute in case anybody has any questions. If anyone's typing anything out, just wanted to reiterate, we will be sending this out via this whole recorded presentation via email. So if you have somebody that you need to share it with, or if somebody missed it, they would be able to see it via the email that we're going to send out. Savannah will also send out some information about booking with Dr. Tahmasian, as he made this beautiful slide. You can see the offices that he will be treating at, as well as you can call and book an appointment, but we also suggest if you'd like to book online, you can use SeaviewOrtho.com. You can go directly to his page, book an appointment, and you'll go directly to our booking. You can also use the right-hand corner of the homepage to book as well. When Savannah sends out that follow-up email, if you have any questions for the doctor that you think about later, you can actually type them back to us as well, and we'll get them to the doctor, who will answer them. And then if he's able to, you might have to come in for an appointment if you have like specific questions that require him to actually see you, but otherwise we'll try and get those answered for you. Doesn't look like anybody else has questions at this time. So I think that's it. But thank you so much for joining us today with this presentation, Dr. Tahmasian. It's been really, really informative.
Thank you for the invite.
All right. Thank you, everyone, for joining us, and have a wonderful evening.